Hello, and welcome to this quick tour of Strategic Quality Support System. Strategic Quality Support System, commonly referred to as SQSS, is a cloud-based tool designed to help healthcare organizations of any size and configuration manage and monitor their ever-growing list of quality-related activities. Its purpose is to support an approach to enterprise quality management that makes it easier to get vast amounts of work done right the first time, while lessening the risk of errors, saving time, reducing costs, promoting greater sustainability of performance over time, increasing accountability, making critical quality information available real time, and beginning to build the big data reports that a new, more consumer-oriented market is starting to ask for. Its goal is greater control over a much riskier and complex environment where the first obligation of a healthcare provider is still to do no harm. SQSS has been purposefully designed to help healthcare leaders exercise better control over the management of quality in order to protect the money and manpower that can be allocated to the direct care of patients and growing the future of their organizations. SQSS brings the activities of quality assurance, quality improvement, performance improvement, risk prevention, and risk management together in an integrated way that supports enterprise quality and risk management. It overcomes the weaknesses associated with healthcare's traditional resource-intensive, reactive, and siloed approaches where duplication, inefficiency, unsustainability, and highly manual activities are too hard on the workforce and deliver too little for what current market expectations demand. The quality assurance features in SQSS foster the efficient and effective management of those day-to-day activities important to ensuring the safety and integrity of healthcare's increasingly complex and safety-critical environment. They help leaders to manage those hundreds of activities that need to get done and be done right the first time without all the added costs of a lot of niche programs. Whether it is checking refrigerator temperatures, monitoring caregiver licenses and credentials, managing compliance with an ever-growing list of important national standards and regulations, making sure that all employees get their TB tests and flu shots done, tracking the quality control activities for safety-critical patient equipment, managing contracts, staying on top of competencies, or making sure that every new employee satisfies the several dozen requirements now associated with onboarding, SQSS is capable of managing it all in one place so it is easier to achieve control from an enterprise perspective in an environment where a typical 100-bed hospital can now have somewhere between 10,000 and 20,000 safety-oriented activities that need to be managed and an equal number of clinical standards that have to be right the first time for the delivery of optimal patient care. Its quality improvement features support the type of rapid cycle process improvement needed in a constantly changing environment where the number of opportunities to make some aspect of patient care and operations better can easily overwhelm even the most dedicated people. When used to its fullest potential, QI in SQSS becomes a powerful tool for managing the multitude of improvement activities that currently exist in healthcare, as the computer system does all the heavy lifting for data collection, aggregation, and presentation, so people spend less time on paperwork and more time on the physical act of improving. The performance improvement features manage the kind of multidisciplinary improvement activities that have become everyday necessities in healthcare's increasingly hyper-complex environment. As achieving just one goal, important to a stronger future, can now require the contributions from as many as a dozen departments, groups, or individuals, SQSS can take something that could easily fail because it resembles herding cats and turn it into a well-organized effort with a much higher potential for success. The effectiveness of SQSS-driven PI is demonstrated by the hospital where its timely billing and revenue collection activities were haunted by over 2,000 late charges a month. Using the QI feature in SQSS, the CFO established a quality improvement initiative for every department that generated charges so managers could document their efforts to retool the work process that allowed avoidable late charges to happen. With a few simple clicks, he pulled all of their initiatives into a PI report that auto-updated for him as each department documented their progress. SQSS took care of aggregating the results, so with a quick glance each month he could check for progress and hone in on any contribution that might need his attention. In 1 year, the hospital achieved a goal it had been working towards for 2 years before SQSS. Embracing a generative approach to business health, SQSS brings the critical activities of risk and quality management together in order to capitalize on the safety-focused goals of each. While the quality side of the program is constantly working to hold and strengthen those activities that foster getting work right the first time, its risk prevention and management activities are making it easier to proactively identify all those risks that have the potential to inflict financial, operational, reputational, and personal harm. When used to its fullest potential, SQSS helps to create the sustainability that healthcare desperately needs for all its quality-related activities that need to happen day in and day out. Leaders work with their people using SQSS to achieve the level of performance they desire. SQSS and the workforce then work together to maintain what has been achieved so leaders can move on to that next opportunity for creating a stronger future. The MyQC's list solves a long-standing problem associated with healthcare's need to maintain control over an ever-growing list of compliance-oriented activities. Leaders, managers, and quality professionals set the system to know what has to be done, who has to do it, who should serve as the backup if the primary user is not available, when each activity needs to be done, and how much time should be allotted for completion. The system then generates a MyQC's list, which stands for My Quality Contributions, for every person in an organization. The list reflects the hundreds of different things that have to happen, like temperature checks, safety checks, license renewals, certification renewals, policy and procedure reviews, TB tests, mandatory training, and contract reviews. People check their lists every day, take care of their contributions, and then let SQSS take care of all the reports that demonstrate their commitment to quality while they stay focused on meeting the needs of their patients and organization. Complex quality activities like hand washing surveillance that have historically been pretty resource intensive to manage manually suddenly become a lot easier in SQSS. In this example, a hospital, taking advantage of what only a computer can do, sets the system to know who needs to be included in hand washing surveillance activities and how often each person should be observed based on the type of patient contact they have. Rather than accepting the risk that the person with the worst technique can get missed in a randomized approach, SQSS can manage a fairly complex schedule that makes sure that every employee gets observed with a frequency appropriate to his or her roles. SQSS can make it easy to set a schedule where nurses, doctors, and clinical staff who have the greatest patient contact in the most risky patient care encounters are observed more frequently than everyone else. New hires can be scheduled for observation with some degree of regularity until a baseline of performance can be established. The need for a corrective action plan because of poor technique can be initiated with a couple of simple clicks and an electronic referral to the right person responsible for making it happen. More frequent observations of the individual with problematic performance can be the product of a few more simple clicks. SQSS can then monitor for completion of the corrective action plan, alert the right people when scheduled activities do not happen, and automatically store and format all the information in reports that make it easy to demonstrate proper monitoring, intervention, and employee-specific performance. An activity that can be more than a full-time job or two if done well manually suddenly becomes doable with a lot less manpower and better results because SQSS does all the heavy lifting. Because of the system's very user-friendly feature for building checklists, it suddenly becomes much easier to automate audits, medical record reviews, competencies, environment of care surveillances, and the multitude of monitoring activities important to managing quality in an increasingly hyper-complex and safety-critical environment. Rather than people spending hours counting check marks and tabulating results, they enter their documentation into SQSS and it automatically pulls everything together into actionable summaries. 2 simple clicks can activate checklists that help people get patient care right the first time for things like compliance with EMTALA transfer criteria, the clinical management of a congestive heart failure patient, and team-based antibiotic stewardship. While SQSS and the workforce are focused on getting work right at the moment in time when it counts most, the system is working behind the scenes to crunch real-time data for the timely identification of weaknesses that represent opportunities to improve. SQSS is made for managing increasingly complex and task-heavy activities like the onboarding of new employees. Everyone with an onboarding responsibility works inside shared checklists while the system tracks progress and keeps everyone informed without a multitude of phone calls and emails. There's no more paper to chase and a lot less risk that something important will get missed. From making the decision to hire to satisfying the ever-growing list of activities that have to be completed before general orientation can begin, to making sure that all those skills important to being an effective employee are addressed, SQSS makes it much easier to manage an activity that has grown to be so complex that the onboarding of one nurse can involve over 200 individualized activities. It is a powerful form of systematization in an environment where high turnover and the constant expanse of what it takes to roll out the capacity of the workforce can now require a small army of people that is never enough. Even the process of separation of an employee gets a whole lot easier when SQSS knows what has to be done and helps everyone to get their parts right. While the first priority of the QA feature in SQSS is to help people get the thousands of compliance-oriented activities that have become important to the delivery of safe patient care right the first time in ways that stop diverting manpower and money away from the direct care of patients, its second priority is to take all the data associated with those activities and instantaneously turn it into usable information. Using the many at-a-glance reports that SQSS is constantly generating as fast as work gets done, it becomes much easier for leaders to stay on top of what can hurt their patients, employees, and organizations. The QA calendar is one of the many at-a-glance reports that SQSS automatically generates in order to take an infinite amount of data and turn it into instantly usable information. The green boxes on this report represent all those safety and quality activities that got done right when they were supposed to. The red boxes are those activities that were scheduled but did not get done. The greener the report becomes, the greater the confidence a leader can have about the safety and integrity of the environment he or she is responsible for. Every box in the QA calendar represents a quality contribution that some employee or team of employees is responsible for. Color, geometric shapes, and how the different colors align convey the status of each activity and how well work is getting done. Simply hovering over a box tells a leader the quality activity it represents and key details about it. Simple clicks allow leaders to instantly drill down into data to better understand how some aspect of quality is looking. Consider the Med-Surg unit with a new manager. While everyone agrees that she has a lot of potential to be great, the fact that she does not have any managerial experience means that a fast-paced and very demanding environment increases her risk of failure. Simply selecting her unit prompts SQSS to instantly filter out everything but what applies to that unit. A quick glance lets a quality professional or senior leader determine that things are going well and that she and her people are in command of their contributions to quality. Rather than waiting to find out the hard way that there is a problem that could jeopardize her success and the safety of the organization, SQSS is designed to support real-time monitoring and management. Taking advantage of what only a computer can do in a matter of minutes, SQSS can take all of those quality activities that apply to individual departments and areas of operation and quickly rearrange them into reports that allow specialized quality professionals like those responsible for infection control, environmental safety, HIPAA compliance, and corporate compliance to see just how good things are looking across the whole organization for the area of risk they are responsible for helping to manage. In this example, 2 simple clicks allow the infection control professional to isolate out all of those activities important to effective infection prevention activities for the whole hospital, and then filter even deeper to see how infection prevention activities are looking on the Med-Surg unit where the new manager is settling in. 2 simple clicks can isolate out all of the quality contributions that did not get done. Another click can convert the calendar of red incomplete tasks into a narrative log. Another click can sort tasks by responsible party, so it is easy to talk to the right people to figure out why things are not getting done. Taking on the power of SQSS suddenly gives leaders access to the level of detail that bridges an informational gap that has always hurt healthcare. Another at-a-glance report that SQSS automatically generates as fast as work gets done is the Task Overview Report. It allows managers to see the performance of every one of their quality-related responsibilities in an easy-to-use format, so it only takes a few seconds to know what performance looks like and what needs help. A simple click in this report allows managers to see inside the teams responsible for the multitude of activities that cannot be the responsibility of just one person. This report makes it easy for leaders to know that Mary Smith is the employee to thank for the strength of their quality contributions, as she is the one taking care of the temperature checks for the vaccine refrigerator 48.4% of the time. The manager can also quickly know that Jamie Dennis and Lisa Massa are full-time employees that may not be making the contributions they could in helping their team to be successful. SQSS automates the managerial monitoring that has become so important as stress and fatigue increase the risk of shortcuts and missed opportunities to get work right the first time. While frontline caregivers are busy taking care of their quality contributions, SQSS is automatically scheduling for managers to complete validation reviews designed to verify that things are getting done right and catch performance that might be a problem. The nurse manager that catches the fact that his staff is just making up cooler temperatures for a piece of equipment where the thermometer has gone missing is the manager that is saving his organization the potential of future grief and added cost because of a problem from the past that will have to be cleaned up if surveyors are the first ones to find it. While SQSS is working with frontline staff and managers to make sure performance is exactly what it needs to be every day, it also makes it easy to schedule those administrative reviews typically done by quality professionals to create the checks and balances important to effectively managing the safety-critical environment. In this example, the frontline staff in the dietary department is taking care of their day-to-day QCs to make sure that food is managed and prepared in compliance with current standards, while the manager of the department is periodically validating that all that work is getting done right. The infection control professional and safety officer are doing occasional audits of the department to validate performance from a quality point of view. SQSS also automates the creation of logs for important activities such as monitoring temperatures and pressures. It automatically graphs results, making it easier to identify those early trends that would suggest that quality drift is in play. When used for managing equipment, SQSS makes it much easier to bring the overall performance of a single piece of equipment together in one place. For this vaccine refrigerator, it is easy to see the quality-related tasks that are assigned to it, all past tasks that have applied to it, all logs for those tasks, all work orders created for it, and the graphical trends for its quality-related performance over time. The newest feature in SQSS allows organizations looking to bring all quality together in one place and reduce the costs associated with niche programs to manage the important activities related to generating and coordinating work orders. It makes it easier for leaders to work in one place as they demonstrate their oversight for a critical piece of an effective quality program while letting SQSS take care of the information integration, report generation, and interdisciplinary communication that make an effective physical plant management program work best. The system's very mobile-friendly design makes it easy for today's healthcare people to work while they are on the move. Its highly robust and automated features for data management and report generation get rid of the paper and manual calculations that compete with people's normal job duties and delay the creation of actionable information. The system tackles the age-old problem of how things will get done when the responsible person is absent. Filling out a couple of simple fields to indicate that someone is going to be absent prompts SQSS to search out every task that is scheduled for that person to complete during that period of time and moves it to the person's designated backup that was assigned when the task was built. The gap in performance that can be created by the loss of an employee is also no longer the potential cause for worry that it once was, as telling SQSS that a team member needs to be deactivated prompts it to isolate all of his or her primary, backup, and validation responsibilities. A few simple clicks can move all of those tasks to new responsible parties so that the work goes on without missing a step. Responding to the need for information in different formats and informational configurations, SQSS is constantly organizing all of the data in its massive database into specialized reports tailored for the needs of strategic, operational, and tactical leaders. At the same time it is generating reports that show the 30,000-foot view of an organization-wide performance that boards and CEOs need, it is also creating the more detailed reports that support operational and tactical leaders in managing quality real time. While SQSS is providing the most senior leaders with that 30,000-foot view of how each clinical and administrative department is doing in managing its quality-related activities, it is also giving them that same view across the 20 areas of risk that healthcare is now trying to manage as a technologically advancing and safety-critical industry. With a simple click at the departmental report, a leader can know that performance in the ambulatory surgery department that was once a problem but became what it needed to be has started to drift. Whether it is because of a change in management, the addition of a new procedure or surgeon that is stressing the workforce, or the product of shortcuts, SQSS supports the business's need to know what is going on and get control of the weaknesses before it becomes a big enough problem to hurt a patient or damage business health. One simple click on the department of concern opens up a detailed report for the deep dive that makes it easy to figure out exactly what is pulling the department's performance down. For those providers who are creating healthcare systems, SQSS makes it much easier to manage and monitor performance across the hyper-complexity of multiple locations. While every location is working in SQSS to manage its contributions for creating a great healthcare system, it is keeping everyone with the need to know in the loop and pulling data together from each of the locations so system leaders can know where their strengths and weaknesses lie. Leaders at the network level can begin with that big view of the whole system and then start drilling down into the performance of individual members to identify best practices and opportunities to improve. Managing just about any quality-related activity gets easier with SQSS. In this example, SQSS takes care of contract renewals and managing their annual quality reviews. The system makes it easy for every key person with a need to access a contract to do so without having to manage reams of paper. It can coordinate review activities, track any corrective actions, and generate the reports to demonstrate great control over a growing area of risk associated with contract services. The rapid cycle management of a quality improvement initiative in SQSS is about cutting the amount of time it can take to get to a desired level of performance by as much as half or more when used to its fullest potential. With a simple glance, a leader can quickly assess the health of an initiative by watching how the project management methodology is cycling, the numbers are shifting, and the colors are changing. The system can be set to any one of the different project management methodologies that are common in the healthcare industry. Rather than dictating how people work, SQSS supports letting people pick what works best for their culture. Once an initiative is built using a simple fill-in-the-blank screen, the user responsible for managing it can activate an easy-to-use wizard for updating it with one click. Clicking on Update QI period once new raw data and action notes are recorded sets SQSS in motion. The system completes any necessary calculations, updates the rapid cycle trending calendar, resets the graphics to include the new calculations, and builds out the storyboard. It then automatically updates any reports and dashboards that need the new information so that they are always ready for the next discussion about how quality is looking and what can be done to make it stronger. Whether tracking a single effort to improve or multiple ones that share a common goal, SQSS makes it easy to create the dashboards and graphics that support timely assessment and action. Creating targeted dashboards and quality improvement reports focused on some important goal is one of the system's strengths. A leader could build 6 targeted reports where he or she decides knowing the infection rate creates value for whatever monitoring and discussion the reports support. Each month, when the infection control professional puts that number into his or her worksheet, SQSS instantly updates every one of those 6 reports along with any other reports that someone else has tagged as needing the rate. Whether the commonality in a report is the effort to chase zero in all those risks associated with being a safety-critical industry or summarizing key pieces of information for the Infection Control Committee, SQSS takes the burden out of the process of customizing reports so people can stay focused on the action-oriented steps. The flexibility of the report generation feature in SQSS allows an infinite variety of dashboards and reports to be built and managed in one place with a common look and feel, so people can spend more time on analysis and less time figuring out what the report is trying to communicate. Whether it is a report tracking a single measure of performance or one as inclusive as a practitioner profile with over 5 dozen data points, SQSS makes it easy to bring data together into actionable formats without the burdens of tying up manpower and limiting possibilities. Reports as complex as the ones that can track nearly 70 measures that have become important to knowing the strength of the revenue cycle for getting a bill out the door right the first time and on time are possible in the PI features of SQSS. As everyone who manages a piece of the process does his or her work in SQSS, it is taking care of the report for the CFO. Due to its robust ability for crunching data, color coding, and arranging data in ways that have meaning to its users, the CFO in a hospital can know at a glance that the midstream revenue cycle activity of case management is performing exactly the way it needs to. The downstream activity of billing and claims submission is getting better, but the upstream activity of scheduling and pre-registration still needs a lot of attention. Rather than guessing where to allocate resources and his attention, the data that is populating to this report as fast as his people are doing their work suddenly makes managing the success a whole lot easier. Building and maintaining balanced scorecards in SQSS is a matter of a handful of simple clicks. Whatever the information is that one is looking to have ready to share, whether with a coworker, a committee, a patient, or the industry leader looking to identify a preferred provider based on data, the dashboard that tracks and conveys one's commitment to chasing 0 in error rates, chasing 100 in adopting national standards for clinical care, and making sure that the patient experience is great can be the product of a customized report that builds as everyone works in SQSS. The system brings the critical activity of enterprise risk management together with enterprise quality management in order to expedite the more timely risk identification and continuous quality management that is important to a safety-critical environment as dynamic as healthcare. SQSS allows leaders to tailor the list of risks that SQSS is helping them to manage to the complement of services that they provide. As fast as a new risk is identified, the risk manager can add it to SQSS so everyone can get busy managing it for a safer future. The system also fosters the identification of risks as great catches and near misses in support of the need to start identifying more risks before they can cross the line and impact the actual care of a patient or a business outcome. Users of SQSS have total control over how their reportable occurrences are categorized and named. They can design and build categories and occurrence types in a simple wizard. Users can create their own customized outcomes for each category, along with adding the key questions that support timely investigation and action. The goal is keeping pace with an environment that is always changing without the need for costly vendor interactions. In this example, a hospital decided on 5 questions that were important for an employee to answer when reporting a new case of confirmed C. diff. The first question identifies whether the patient had one of the high-risk exposures or conditions that made him more susceptible to the illness. The rest of the questions are tailored to help the staff get the next steps right in controlling for the spread of a highly problematic bacteria that can become a much bigger problem if it is not properly managed. SQSS immediately notifies the right manager and quality professional at the time it notifies the risk manager when a non-confidential occurrence is reported. Doing so frees the risk manager up from the time-consuming responsibility of disseminating information. At the same time, it triggers more timely investigation and action planning by the people with the greatest understanding of why the risk exists. If the event is an infection, SQSS notifies the risk manager, infection control professional, and the manager of the unit where the infection is. If an employee is injured, the risk manager, employee health professional, and manager of the employee injured are all notified so everyone can be on top of protecting the impacted employee. At the same time, they are working on the answer that will prevent another similar event. A HIPAA violation instantly brings the risk manager, HIPAA compliance officer, and the manager where the violation occurred together to spearhead the protection of patient information. In the same way, all of the tools on the quality side of SQSS allow people to work more efficiently and effectively. The risk management log uses color coding and a number of different action buttons to make it faster and easier to coordinate team-oriented, fact-finding activities while building the documentation trails necessary for demonstrating timely actions, initiating quality improvement efforts important to mitigating future risk, building reports, and monitoring for success. In this example, the pink highlighting indicates that the occurrence is now 21 days old without a corrective action plan in play yet. The bold print for the culture that came back positive indicates that it has not been opened and reviewed yet. All the action buttons to the right of each occurrence initiate some risk management activity that facilitates the timely management and closure of each occurrence. The risk management piece of SQSS contains a highly robust sorting feature similar to those found in the quality reports that makes it faster and easier to look at occurrences from a lot of different perspectives and combinations of perspectives, so to expedite finding those trends and patterns that, if addressed, can reduce the chance of future harm. The graphics generated are the product of quick sorts to isolate the data that one is looking for with a couple of simple clicks. Root cause and trajectory of error analysis are also supported in SQSS. With a few simple clicks, the risk manager can build a team, assign a leader, and set the analysis for why the occurrence happened in motion. As soon as the team identifies the opportunity for improvement, the quality improvement initiative that will create the remedy can be set up on the quality side of the system. Working together, risk management and quality professionals can use SQSS to more easily coordinate their work with the people on the front lines. In summary, SQSS is a tool designed to help our healthcare providers more successfully and cost-effectively manage quality from an enterprise perspective in an environment where demands will only continue to grow while the healthcare dollar shrinks. Its purpose is to introduce the power of electronic systematization into the act of quality management, where getting work and patient care right the first time in ways that manage money and quality like they are two sides of the same coin is becoming increasingly important to a provider's financial, operational, and reputational health. If you would like more information or to schedule a demo of the system, please contact Nicole by using the contact information listed on this screen. Thank you and have a great day.